Hi, welcome to the medication administration training. During this training, you'll become familiar with the Michigan laws and become skillful in the task of medication administration in the school setting. Our goal is to keep students in school and learning. There are a significant number of students in our school that have health conditions and may require medications that need to be administered during the school day. Because the nurse can't be in every building all day, we rely on school personnel to be trained to help these students with medications and treatments. We'll review the Michigan School Code number 1178, which states that a school administrator, teacher, or other employee designated by the school administrator in good faith administers medication to a student in the presence of another adult, except in the event of an emergency, pursuant to written permission by both the parent, guardian, and the physician in compliance with his instructions. You are not liable for any criminal action as a result of giving medication to a student, except for an act amounting to gross negligence. We'll review ways to avoid gross negligence. So make sure that you're aware of your district policy and that you're in compliance with your district policy. We're going to be observing the legal rights and privacy of the student. And examples of that would be that the student is offered a private place to take their medication out of the eyesight of other students or staff members, that the student is afforded an opportunity to not have their records reviewed by another student, like with a medication book left open in plain sight. So those are a couple of examples of privacy. You're also not going to talk about what the student is doing in the health office if another student asks, what are they doing here? We're going to understand the use, the action, and adverse or side effects of medications and treatments that you might be administering. An example of that might be medications that may make them dizzy or nauseous. You're going to make sure that you know what the medication is used for as well. And if you're unsure about any medications or treatments, please make sure that you contact your school nurse. Let's review the school policy. So your school will have a specific medication policy that you should adhere to. And most districts use Neola policy number 5330 is the medication policy. And we're going to pause here so you can review your policy and your medication forms. We're going to talk about when to refer to a school nurse. Keep in mind that only an RN can accept physician orders. You would refer to your school nurse if the medication or the dosage needs to be altered in any way, such as if a parent calls and says that Johnny is no longer on his medication, or his dosage has changed and they're requesting that you give him a new dosage. Please make sure that you contact your school nurse for that, because there's a process that we need to go through to make sure that that happens. Please call us if your student is experiencing side effects or an adverse reaction, or if your student is refusing medication administration. Just a couple things to keep in mind. We need doctor's orders to change doses, not just a parent, except in the event of an insulin order, and you could talk more with your school nurse about that. Filling out a new medication administration form would need to be done by your school nurse. When a student refuses a medication, that needs to be reported to the parent and to the physician. And also, students who do not remember to come in for their medication need to be reminded. And if you are the one administering the medication, it is your responsibility that the student is coming down to the office. And whether that's calling into the classroom, and asking for the student to be sent down to the office. What do we need to get started when a student starts medication? We need a district medication form or something called an IHP, or an individual health plan. That contains the written consent from the parent guardian and the written order from the physician. We also need the unexpired medication in its original container. We need to make sure that the medication matches what is on the form and what the parent or the guardian brings in. And then we would need to count the medication in front of the parent or guardian. The written order must be renewed on an annual basis or yearly basis, or more so if the dosage changes or the medication changes. What needs a doctor's order? Any prescription medication needs a doctor's order. Any over-the-counter medication needs a doctor's order, such as Tylenol, ibuprofen, any herbal treatments, emergency medications like inhalers, EpiPens, Diastat. Feedings need to be ordered by a physician, as well as if a physician feels that a student can self-administer their own medication. That does not include prescription oral medication, but might include inhalers, EpiPens, and over-the-counter medication. The storage of medications must be locked. Except in an emergency medication, they have to be readily available. So they have to be in an unlocked cabinet where you can get to that medication quickly, such as an EpiPen or an inhaler. Parents need to pick up the medication at the end of the school year when it's expired or when it's discontinued. And any medications left at school that have not been picked up need to be disposed of properly, and you can refer to your school nurse on the proper disposal of medications. Typically, we give parents a week after the end of the school year to come in and pick up medications. For field trips, medications that are to be handled by school personnel and are to be given to the student by school personnel must be trained in the medication policy. And the medication order and the medication itself, along with the log, need to go with the student on their field trip. Overnight field trips, if you're aware of an overnight field trip, please make sure that you have the nurse in on that. She needs to be aware so that she can get the proper orders and the signature from the parent as well. We're going to now review the 6 rights of medication administration. These are very important. We need to make sure that we are giving the medication to the right student. It is the right medication in the right dosage, going by the right route. And what I mean by that is if it's inhaled, if it's an oral medication, if it is an injectable medication such as insulin or epinephrine, at the right time. So that would be the time on the medication form, and the right documentation on the medication form is taking place as well. So those are the 6 rights of medication administration for your student. So let's talk about the first right, which is right student. So in order to do that, you're going to make sure that the student gives you their full name. You're going to give your full attention to that task, and you're going to give that student their privacy. If you're unfamiliar with a student, please make sure you check their picture in Infinite Campus or Power School, or you can ask a teacher to verify their name. The second right is right medication, and so you're going to be comparing the prescription bottle to the physician's order, and then you're going to compare that to the medication card as well, if your medication is in a card. If they do not match, do not give the student the medication and contact your school nurse right away. Some medication may have a generic name that will not match with the brand name, and that would be another instance where you would call your school nurse in that event. Such as medication order may say Ritalin, but the prescription bottle might say methylphenidate. The right dose is also important, but sometimes on the bottle it could have teaspoon versus milliliters. So you want to make sure that you contact your school nurse if you have any questions about that. The fourth right is the right route. And so what that means is what location in or on the body to give the medication, eardrops versus eye drops. Some special directions such as opening a capsule, taking that medication in yogurt, and you're going to make sure that you watch a student who has to swallow their pill to make sure that they in fact did swallow their pill. The fifth right is the right time. And so the window of time allowed for medication is 30 minutes before to 30 minutes after the prescribed time. So if you have a medication that is ordered for noon, you can give it as soon as 11:30 and as late as 12:30. As needed medication, the only thing you need to make sure of is that that there's been a proper amount of time since the last medication administration. So if you have a medication that says it can be given every 4 to 6 hours, you need to make sure that if that student comes back again for medication, that it has been at least 4 hours before you administer that medication again. And once again, I'll mention that the right time does include that if that student does not come at the time the medication needs to be administered, it is your responsibility to locate the student and have them come down to the office so they can have their medication. We're going to review the right documentation, which is their sixth right. You're going to document this on your medication administration log. You are going to be having a witness document with you that you gave that medication to the right student, and you should document that immediately after a dose is given. The only time you do not need a witness is in the event of an emergency medication that needs to be given. So safeguards beyond the six rights, please make sure that you're giving your full attention to the task. It can be easy to get distracted by a ringing phone or a person that comes into the office and starts to talk to you right away. So you need to make sure that you give your full attention to that task. Please remain with the individual until the medication has been taken. You only want to prepare medication for one student at a time. Please don't prepare multiple medications for students because you know that maybe 2 or 3 students come in at the same time. Don't try to hide a medication error. We've all made medication errors. Just make sure that when you do make a medication error that you recognize it right away, and please contact your school nurse right away. And then always doing that triple check. When you get the medication out, make sure it's the right medication for the right student. When you're dispensing the medication, and when you're putting back that medication. So it's that nice triple check, and then of course documenting that medication as well. Some examples of different medication errors would be you gave the medication to the wrong student, you gave the medication at the wrong time. So just report errors, don't hide them. Building administrator needs to be notified, your school nurse needs to be notified, and the parent and the physician needs to be notified, and the school nurse can assist with all of that. We're now going to review the proper technique for administering different types of medication.